Welcome. I want to show you a great technique to help elongate the hamstring muscle. The hamstring muscle is behind the upper thigh area. The hamstring muscle is designed to help bend the knee. When the knee bends or flexes, the muscles are engaging. Now, with this particular muscle, this muscle attaches underneath the ischium, around the ischial tuberosity region, in the lower back area here, and attaches down to the knee level. So when that muscle contracts, it's obviously going to pull below that knee to allow the knee to flex. The other negative thing about tight hamstrings is that it affects the back directly, meaning that if you lean forward and those hamstrings start to lock out, become tight, all the stress goes to the pelvis, the sacroiliac, the sacral region, as well as the lower back area, which is something that is common that causes lower back problems, lower back pain. You can actually hurt the disc. So by elongating the hamstrings is going to allow you to flex easier, particularly brushing your teeth, picking things up off the ground, or whatever you're doing when you have to lean forward. Understand when you lean forward, your hamstrings are engaged, and if they're tight and they stop right here, then it all goes to the lower back, and then when you bend more, this whole upper weight of your upper torso puts excessive load on the lower back, causing significant lower back problems. But this particular technique, PNF, proprioceptive neuromuscular facilitation, we're going to facilitate the back of the hamstrings and doing this on our own so we can increase flexibility. We can elongate that hamstring more than you think we can. So what I'm going to do is I'm going to stretch my left, I want to stretch my left hamstring, and I like to do each one individual. A lot of people will put both of them up and go forward, but in order for us to focus on this left hamstring, what we want to do first is that I want your foot a little bit off the table, off the bed, wherever you put your foot on, the couch, whatever it is, it must be off. I don't want it directly on, otherwise you're not going to be able to engage the hamstring during this particular technique. So the first thing we're going to do is we're going to take our chest and we're going to lean it forward to our knee. Now try to keep that knee straight. And as you go forward, it starts to hurt. And where it hurts, I want you to hold that about 10 or 12 seconds. Okay? Now, we have Golgi tendon organs inside the musculotendinous area that if we go too far, they start to kick in to prevent the muscle from becoming injured. But we don't want to go to that point to where we're having significant pain. Just where it's tight, where it aches, you hold it. Now, what I want you to do now, I want you to bend the knee now and take your back of your ankle and push it towards you as if you're contracting. You're pushing, you're contracting the hamstrings right now, and you're actually squeezing it. Do that for about 5-6 seconds. Now relax it. Now I want you to go forward again. And as you go forward, you're going to notice you can go more forward because we're tricking the brain through this neuromuscular reeducation, proprioceptive neuromuscular facilitation, PNF, and now we can go a little more forward. Hold it there about 10-12 seconds. Okay? After 10-12 seconds, you're going to come up again, take that back of the ankle and push it down against the edge of the table as you're squeezing and contracting. You're flexing the knee, but you're holding, you're engaging the foot on the table as you're contracting the hamstrings. Come on, push, 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 push. 7 seconds, 5-6 seconds, relax. Now I want you to go ahead and take your chest and go back down to the knee again. Wow, you see how much further you can go? I'm talking about big time. Now you're going to do that about 3, 4, or 5 times on each side. And as you do that, you're going to really increase that range of motion in the hamstring region. Now you may be one of those kind of people that you always tell everyone that I have tight hamstrings. Well, this particular technique, you're going to beat it because you're going to tell that brain something different that you want to do that the brain doesn't want you to do unless you can trick it. So that's what we're doing here. Do that technique. You can do that daily if you want. You'll notice you'll get a whole bunch of increased range of motion. You'll notice that when you lean over and bend and do things, it's going to take a whole lot of pain or pressure off your lower back. Those suffering with herniated disc, bulging disc, degenerative joint disease, arthritis, osteoarthritis, spondylosis, whatever you have, increasing the length of those hamstrings is going to help save your back. I really hope that this video comes in handy for you. I'm sure it will. I ask you to share it with those that can benefit. Subscribe so you can continue to receive the best of the self-help videos here on the internet. And most important, Make it a great day. I'm Dr. Alan Mandel.